Hello, everyone. Thank you for all coming to this webinar. As you see, I work for, it's a contract laboratory, and we do a lot of human and animal research tissues. So, but I have worked in hospitals, and I've worked in veterinary diagnostic laboratories, and so I have a lot of training with cryostats, unfortunately, and 20 years of it. So hopefully I can give you some good ideas, some hints of how to get through things. What we'll do, we'll talk about frozen sections. What we'll talk about a little bit about the equipment, the freezing methods. I'll give some alternative freezing methods if things aren't working right for you with just using liquid nitrogen. So we'll do some things that are different that you can possibly try if you're having problems. What we use these freezing methods for, and it could be for research or for clinical, and the microtomy. We'll have a quick, brief way of cutting the sections, and of course storage, because it's really important. Sometimes we use frozen sections and we kind of keep them for controlled for immunostaining, and so we want to be able to do that correctly. We have advantages and disadvantages of cryotomy. The problem with frozen sections, nobody likes to do them, and especially don't want to do them all day. The people that do Mohs techniques, they can only do it for like 5 hours a day. It's just really difficult to do it all day long. But the nice thing about it is that you can get a diagnosis. It's fast and it's simple, and it really is easy to learn. Now, I'm not saying you can do everything really well, but it's when you have like certain tissues that you want somebody to learn to cut, it's pretty easy to teach somebody how to do that. The nice thing about it for IHC, for any kind of antibody staining, you don't have to use as much antibody when you're doing immunostaining. You can avoid neutral buffer formalin or paraformaldehyde fixation. There is no antigen retrieval when you're doing IHC or digestion. There's little, if you're doing immunofluorescence of any kind, there's little autofluorescence. It's really nice, it cuts down on it, but there are still some tissues that will autofluoresce no matter what you put it in, whether it's paraffin or freezing. There's only one instrument you need. That's really nice, but it would help if you had a microscope too to look at it. But cryostats, and it's the only thing you have to have in the lab. And Gail Callis is a good friend of mine. She put that in as a way to stay cool in the summer. And I don't understand why she thinks that, because she lives in Montana. But it is a nice way if it's really humid and hot where I live, and you can stay cool. There are disadvantages, which don't outnumber the advantages. And the tissue handling, when you're preparing it for frozen sections, it is troublesome sometimes. You know, it's hard to keep everything frozen. It's hard to get things cut, especially like breast tissue and stuff. The fat is really difficult to get it frozen hard enough to get nice slices. Everything's fragile. Usually, like if you're trying to do endometrium, the blood, it's so fragile, it falls apart. It's very hard to keep it together. And you can get poor morphology, even if you cut great sections. It all depends what kind of fixation you use on the slide. Some solvents can really mess up your morphology. It is inconvenient for storage, because I don't know, the labs that I worked in until now always had small freezers. And we just never had enough storage, especially when I first started doing immunohistochemistry. It was back in 1980. We had to freeze everything, and we had to store the tissues in there until we got the results back, or if we had to do it again. And of course, then there's biohazards that you have to deal with, because you may have a lung that has TB or something and you don't know about it. And so the cryostats now are really helping us prevent any kind of spread of that, troubles that we have, the biohazards that we have. But all those that are marked with the red asterisk, they really are not unsolvable. I mean, we can figure it out as long as we know what tissue we're dealing with. The examples, the equipment examples, here's the Sakura one. It really, you know, all the equipment nowadays is really, really nice. We have, you have to make sure though when you go to do frozen sections, or if you're in the market of buying new equipment, cryostat, you need to know and practice with several so that you buy the right one, because some of them have adjusting height that you can go ahead and sit at or stand at, or a tall person can stand at or sit at, and some of them have where they cool the chuck holder, they cool the knife, and then they also have automatic decontamination features. They have a lot of neat features. I've used a lot of different cryostats, and you know, you can get anything as long as it fits what you need. If you do a lot of frozens, you want to get something that's comfortable to use. So it's really important. Now I was lucky enough to get to use some of this equipment. I do whole body autoradiography at times throughout my career, and we would cut whole mice, whole whatever, and look at the radioactivity. Well, they don't do that so much anymore, but they still, and when I went to China, they still use the black one on the left. They do that. They use that for paraffin. We used to use it with a freezing stage and freeze our brain tissue. And how we froze it was we would put it on the freezing stage and drop it, water on it, one drop at a time until it completely froze. So we've come a long way since I used those, and thank goodness. But they are available for anybody that has to do research. A lot of hospitals now are tied up with universities, and so they get, sometimes the technicians, the histotechs, we get some research to do, and it's kind of fun because it's different than the normal routine. We have a lot of freezing aids. Of course, any of the embedding molds are an aid for us because we don't have to make our own blocks or put it in paper boxes. Years ago, we used to put them in paper boxes and freeze them and stuff. And it's really convenient for us to buy molds of some kind. And usually a clinical laboratory has some type of plastic or a metal mold for their paraffin, so they can pretty much use that for their cryosectioning. Another freezing aid is an instrument. It's called the Miami Special, and no, it's not a gun that you shoot your cryostat with, but it is a piece of equipment that is used to get really flat, nice sections. We'll go through it and show how it's used, because it works well if you're doing Mohs or if you're doing sections that you really have to have a certain spot. And then the CryoCut, which also is a freezing aid. Okay, tissue collection. One of the things is that once it's removed, we should fix it or freeze the tissue quickly. I have often received tissue from surgery that they wanted frozen sections on that was already in fixative. So that helps. You know, it makes it a little bit easier to cut, and the morphology looks a little bit better. And I always used to like when they come down with breast tissue that they wanted frozen right away, and they had it in fixative, because that would really help some. You can store it when you collect it. They can throw it in PBS, and that helps to, like, if you want to group tiny lymph nodes or something when they're doing a mastectomy and they're looking at the lymph nodes, and some of them could be really small, and you don't want to cut one at a time because they're so tiny. And the only time that you wouldn't use the PBS is if it's not recommended. If you're going to do something down the road, a stain or something like that it may interfere with. It's really important that you don't embed 2 tissues or even 3 tissues with different cutting qualities in one block. It's really hard when you have like a liver or a lymph node or together, because the lymph node, the liver is tougher to cut, and it's more consistent than a lymph node is. And so when you cut those 2 together, it really makes it, the knife will pull and gouge the lymph node some, because it's pushing, you're pushing harder whether you feel it or not to get through the liver. Now if you have an automatic cutter, it would, it would cut okay, but your lymph node would then look too thick, because when you freeze the tissue, it shrinks up a little bit, and then your lymph node's going to cut the same thickness as your liver, because it's really forcing it to cut a little harder because of the consistency of the liver tissue. So you don't want to do like gastric biopsies with a kidney or something like that. You just don't want to put it together. You try to keep the same type of tissue if you want to put more than one tissue in a block, like a group of tiny lymph nodes or something. And sometimes you can have a situation where you have to fix or freeze the tissue immediately, because if you're doing fish or fish that requires a frozen section, the probe type will also determine how you need to do that, if you need to fix it or freeze it right without fixation. So you always have to depend on the probe if you're going to do fish or any type of ISH. Okay, we always use some type of embedding mold. It just makes everything easier and it keeps everything consistent. There's the Tissue Tech plastic cryo mold, which is nice and flat, and it's not real deep, and the tissues pop right out of that. The peel-aways, the nice thing about them is that they're deep, and once you have something embedded, it just peels off. I use a lot of them for bone, and we do some bone tissues and small pieces, not really big, but small pieces that we put into a special type of embedding media so that it will hold it in there and we can cut nice and easy. I use the metal molds a lot because they're there and they're easy to use. And the cryo embedding media is designed to surround and support the tissue, not usually to infiltrate it. So we don't really need it to be in there for a long time. Every now and then you might get something that has like lung tissue or something that you'd like to try to get it infiltrated a little bit to fill in those spaces, but not very often. It's mainly to hold it in place. I would try the different molds that work for you, that are more consistently used than go try a whole bunch. But try one, and if you like it and it works well for most of your stuff, then I would stick with that. The embedding medias, I would try different brands depending on what is the majority of the tissue that you cut. Like if you're cutting breast, you want something that'll really hold it, because it's just difficult to cut breast, or at least fat tissue. It's really difficult. And you have to get it super cold too. One of the medias that I use, like I said, I use a special medium for bone, and it really is wallpaper paste. I buy powdered wallpaper paste, mix it up, and then freeze it, and it really holds it tight. So if you have a tissue that you're having difficult keeping it in the frozen block when you're cutting, I would go ahead and mix up some wallpaper paste and put it in. It doesn't hurt. Now, it will stain, like if you use hematoxylin will pick it up if you don't rinse it off enough before you stain it. Okay, I'm going to go through a couple alternative freezing methods for people, because not all tissues work well when you just drop them in liquid nitrogen to freeze them. Sometimes you need to slow down the freezing method, or you need to make sure that the tissue stays completely flat and that while it's freezing, so that you can hit a certain spot. So there are a couple methods that work really well. Dry ice and 2-methylbutane mixture. Unfortunately, that's a solvent, but it works well. Petri dish floating in liquid nitrogen, which is really nice because the liquid nitrogen really doesn't touch the tissue. Slow freezing using the hexane and dry ice. That's when you have something that will crack if it's fast frozen. Slow freezing using a block of dry ice, and that's something, if it's a usually large piece of tissue, that will crack if you use any kind of solvent with it. And the immersion method. One of the things we want to come up with is we want to make sure that we don't end up with a freezing artifact. That's one thing that can really create a problem when the pathologist looks at it and says, I'm not sure what this is because I have so many ice crystals or I have holes or something. We just don't want, we want to try all the methods and get the best one that works for us where it doesn't cause freezing artifacts. One thing about using dry ice is it avoids solvent recooling, because the dry ice, especially the block ice, you don't have to recool it. It does stay cold all the time. Some of them are good for if you have multiple block freezing sessions. So if you have like 4 or 5 tissues in a row that you need to embed, some of these work well when you have that, because it keeps the solvent cool to the right temperature. The problem is sometimes you don't have a fume hood close by when you use solvent. So that would be one reason that you would eliminate, but you should always use a fume hood with the solvents because they're very, they smell bad and they're not good for you to inhale. They're usually pretty bad mixtures. And of course solvents required is a problem because it's a hazard. One of the things when you do use a solvent to embed, to freeze the tissue, you need to let that block air out, because it does have, the fumes are really bad, and it's bad for when you put them in the freezer to keep them for later, just in case, you know, saving tissue just in case. It can explode in your freezer. So you need to let them air out, and usually you can let them air out in your cryostat because there's circulation in there. All right, let's go snap freezing dry ice with the 2-methyl butane mixture. You pre-cool your solvent before adding the dry ice. So I usually pour a glass beaker, and use glass beakers because the little polyethylene, whatever, or the polypropylene beakers, they don't get cold enough. Even when you put the dry ice around it, they just keep the temperature pretty low. So use a glass beaker, put some of your methyl butane in there, and then you stick, once it gets cold, you stick it into a bucket, styrofoam bucket, and then pack it dry ice around up to the level of what your methyl butane is. You go ahead and take your mold, and you put a little bit of OCT in the bottom of your mold, and then you put your tissue in and hold it flat and fill it up with OCT. Take that mold and set it flat while holding it with forceps on top of the mixture. As soon as it starts turning white, let the block drop in to the mixture, and it will float to the top when it's frozen. Pull it out, let it drain, and you can do your next one. So this is one that you can do multiple tissues in, or at least embed multiple tissues. And here's snap freezing with different molds. That's what it'll look like. One's really deep on the right, and the other one's a shallow mold. So you can do it either way. Just make sure that it starts to freeze. The OCT or whatever you use starts to freeze and turn white before you drop it into the bucket. This is the one that we used quite a bit for tissues that were small, and we needed to keep them flat, but we didn't want them exposed to the liquid nitrogen all at once because they had a tendency to crack. And so we take the liquid nitrogen. Now this is, like I said, everything's exaggerated of how you should do it. You can use a smaller Petri dish, you can use a smaller little bucket because you don't really want that much liquid nitrogen floating around in there. So you get a styrofoam box or little type of box, and sometimes your antibodies will come in like a little styrofoam box and with dry ice packed around it. So use one of those and get one of those little tiny small Petri dishes and put like a little stand on the bottom so that Petri dish can sit on it. So then you fill up the box around the Petri dish up to the edge of the Petri dish. You don't want to go into the Petri dish. You want it to just sit around it and cool the Petri dish down. So this little box or whatever you put in there, it could be like a slide holder or something in there that will hold it up and let it kind of float a little bit on the liquid nitrogen. Put your tissue in, your cassette, and make sure it's flat, and then put your OCT or whatever you're using for embedding and then let it sit in the Petri dish. Set it down in the Petri dish. It will freeze for you because the liquid nitrogen will have that Petri dish cold enough to freeze that without your tissue without liquid nitrogen touching it. If the liquid nitrogen goes in there, it will cause cracking. If you're using tissue that cracks very easily, if the liquid nitrogen goes into the Petri dish and touches the tissue block in any way, it will make it crack. So this is one way that when you're doing, especially like lymph nodes that are very delicate, very small, this is a nice way to do it, and they're all right there because they're flat from the very beginning. Slow freezing. This one I use if you can't freeze something extremely fast because it's a little larger than usual, and it's one of those delicate tissues that will crack or break. For research, we do a lot of brain research, and sometimes, you know, they will crack if you throw them into liquid nitrogen. So we do a couple different methods with that, and hexane is one of those that solvents that slows down. It reaches the right temperature, but it slows down the freezing so that there's no cracking that can occur. And it's the same thing. You put the hexane up to, pour it into a glass beaker, pack the dry ice around it up to the level of the hexane, and then put your tissue in the mold, put a little OCT, and then make sure the tissue is positioned correctly, and then fill it up with your OCT or embedding media, and then let it freeze while it's flat, and then drop it in as it's starting to turn white. Using the hexane and dry ice method, it works really well for small pieces of bone. We used it for bone tumors. We would cut out a small piece of bone that had tumor, and then we would use it in this way. It would not crack the bone, nor will it crack the tumor that's inside of it. So it is a handy little method and pretty basic. This is one we use a lot if we have, like a pancreas piece or something like that, or a brain. We don't want it. We want it to we want it to be very slow freezing because, one, it may be large, and we have to cut the whole thing. If we don't have to cut the whole thing, we'll cut it down, the tissue down. But if it cracks easier than other tissues, then we take the tissue. Well, actually, we take a piece of block of dry ice, and we set it down under the hood. We take a piece of parafilm, which is like wax, dental wax, or parafilm from that you use to seal the tops of speakers or whatever you're mixing, and lay that down flat on the dry ice. Let it cool down, and then set your tissue on it. Put a little dish or a beaker on top of your tissue so that it keeps the cool in, and it will slowly freeze. And you won't have any tissue damage or anything. It will freeze nicely. With all these methods that I described here, we rarely see any type of freezing artifact. If it's an unusual tissue, not spleen, but if we have pancreas or something, we'll see some, but not very often. A lot of people are surprised when we get done cutting that these are actually frozen tissues. So they do work. You just got to find the one that works the best for you. And like I said, these are alternate freezing methods. And of course, the good old liquid nitrogen. We use that a lot, especially with biopsies. We would go ahead and freeze it just so that we could get it done quick enough for in the hospital. You know, everything's now. And we had other things to do, so we would do it, and we would get nice sections with it. But we realized that when we were doing that we had to look at alternate freezing because we were getting some cracks and stuff, and we weren't getting the great morphology. So not all tissues like liquid nitrogen. And you know, you freeze the tissue itself, embed it, and then freeze it again so that you can have something surrounding it to hold it in place. Or you can go ahead and throw it all together, the freezing, the embedding media, the tissue, and then freeze it in liquid nitrogen. Liquid nitrogen is used for Mohs routinely. The thing with it is that they have a special way of freezing it. They somehow keep the liquid nitrogen at a certain temperature. There's a freezing mechanism that they use, but they never have problems with the skin curling or anything like that when they use liquid nitrogen. So they have their routine that they use, and it's a whole different story when it comes to Mohs technique. And hopefully they'll have a Mohs for you, for those that do Mohs seminar. Okay. I talked about the Miami special, and like I said, it's not a gun, as you can see. It actually is made by this laboratory. It's hemostat. As you can see here, there's clamps. It clamps shut. There are two paddles up here, and you notice there's a hole in one. You put your little chuck end in there, the little knob for the older cryostats that has a knob to hook your chuck up to the cryostat. And then you put your OCT or embedding media there. Put your tissue on it, the chuck, and then you clamp it together, and it'll keep it completely flat. I've seen this used in Mohs techniques a lot. So if you have to have something that's really, really flat, this is the best way to do it. You clamp it, stick the end of it in. Oh, and do put gloves on when you're holding the end of the hemostat. You need to have gloves on. It gets cold too. And put it in the liquid nitrogen. I put the email address for you to get it. They make them only after they're ordered, and they want to know what you're using them for. So just tell them you're using them for frozen sections, and that's it. Okay, the Davidson's CryoCup system. This is really nice when you have a bunch you need to do, because you can stack these on here if you want to. It's a cup. You put your tissue in the bottom of this cup here, the empty cup. You stick your chuck, you put your embedding media there, stick your chuck on top of it in the cup, and you set it in this little round circle on this handle. Now you can do several of them. You can stack the cups on top of each other, and then you put this lid over top, which has a little ventilation there. You put this lid over top of the cups, like there, and you drop, and you hold it, and you put it down into liquid nitrogen. And you have it nice and round, and you have everything in place. They're real handy to use if you have to do multiple tissues in one setting. So you might as well go ahead and just buy it and have, they give you like 4 cups, I think, with it. So you can stack up to 4 on there and freeze them all at one time. And it really is nice. What you do is you place your tissue in the specimen cup, and we went through that real quick. Keep the level of OCT even with, but not above the inner edges of the cup, because that's really important. If you go over it, it gets really messy, and then you have to trim things down. And so it's really, we went through the whole thing. You lower the cover, making sure to center the chuck stem and the opening of the cover. The cover does have an opening, so that will hold the top one in place. Immerse it in liquid nitrogen and freeze and keep it long enough to make sure that all your tissues and all the cups are frozen. Remove it from the liquid nitrogen. You have to wait about 10 to 20 seconds, and you have to let them warm up just a little bit, but not a lot. And you tap the cryo cup on the countertop, and it will, and the chuck will come right out with the tissue on, and it's just ready to microtome. It's really a handy little gadget. Embedding hints. Different tissue types together, cutting rows. Yeah, if you put breast and lymph node together, it really is not good to try to cut it together, because, like I said, the fat from the breast tissue is totally different consistency than the lymph node. Breast, make sure the specimen has most water removed before embedding. You know, especially if you get it out of fixative or PBS, kind of roll it on a towel and then go to freeze it, because that really helps with the cutting in the end. You extract as much water or either absorb as much water as you can out of that tissue before you embed it. It makes a lot of, it helps a lot. GI box, or GI, the one thing about, like, if you're doing some intestinal tissues, wash with PBS or water before you freeze, you know, and dab it on the towel in case there's any waste inside of it or attached to the wall, and then just dab the outside wall on a towel to get the water out and then freeze it. The biopsies, do not rinse those because they're pretty clean because they usually get those after they had a colonoscopy or an endoscopy, so they're pretty cleaned out. So you don't have to rinse them, but I would suggest that you embed them at an angle so that you see both sides. You see the muscular area and the biopsy together on the edge. And it's easier to cut them when they're at an angle. Lung, you might use some type of embedding medium that has some rifampin or something inside that will, especially sputum and stuff, if you have to do any frozen sputums when you spin them down, put something in that will help protect you because you don't know if this person is contaminated with TB or whatever. And it's more common than you think that you'll have a patient with TB and not know of it. Cryosectioning temperature recommendations. The thing is that, you know, every one of the places, the vendors that sell cryostats will give you a temperature list. They know from testing their cryostats at what temperature is the best cutting temperature for certain tissues. So we give this, I give this as an example of what we found worked the best for us with our cryostat. But our cryostat, when we bought it years ago, came with a list itself. But from use, we found out which works the best. And so we post the list up in front on the wall in front of our cryostat so that we know that we need, if we're going to get a biopsy to come down or a lymph node or something like that, we get that, we make sure the cryostat's at that temperature. Now we have 5 cryostats here, so we have 5 different lists. So the best thing is to look at the recommended temperatures for the tissues that the vendor has tried and tested, and use that to start out with, and then do your own if you do a lot of frozen sections. One of the things that I found that when we were doing skin, but it was not a Mohs, we just needed to see the skin, we needed to see the glands underneath the skin. We folded the hair where either the hair would be on the skin, we folded it to the inside and held the tissue and froze it to a V shape. And then we would cut the bottom of the V out to the top. Because that way it doesn't pull, the hair doesn't pull the knife or chip the knife because it'll cause scratches. It'll be in the inside, which we needed to see not the dermis, but underneath the dermis. And so we needed to see the glands underneath there. So we found that putting it into a V shape helped. Bone, it has to be super cold. 30 degrees, minus 30 is probably better than all of them. We use a tape method to do that. And lung, we found that it had to be super cold too, especially if it was a lung biopsy. Cryosectioning knives, there's all kinds. There's stainless steel. For hard tissue, tungsten carbide, I have a regular knife holder on mine. That's one of the things when you go to buy a cryostat, make sure that you have multiple knife holders because it's really important that you can change to other knives. Sometimes disposable blades will not cut all of it. They're usually pretty good, but they are not the cure-all, but they are good for majority of the tissues. And so here's some examples. Like I said, I use a tungsten carbide knife, especially when I'm doing bone and eyes. We have to do some frozen eyes every now and then, and the tungsten carbide knife really works a lot better. Cryostat preparation. This is really, really important. You have to clean all the items in that cryostat before you use it if it hasn't been cleaned. Having 5 cryostats, you can run up on a cryostat and find out, and you think you're going to use that one particular cryostat, that the last person didn't clean it out. And one thing we don't want to do, especially in the hospital, is we don't want to cross-contaminate or have a cancer cell laying there somewhere, and we pick it up and this person really doesn't have it. So we want to clean all the items and areas. So in the morning when you come in, check and make sure your cryostat's clean. You should wear gloves at all times because you never know, even after it's been decontaminated, you never know what you're getting your hands into. If you're doing one patient but several patients at one time, you have several frozen sections that are coming in one after the other, change and clean the knife or area of knife between each tissue type and patient. So, because you don't want cross-contamination. And we're all well aware of that, but you know, nowadays patients, when they come up with something, we're seeing a lot of medical mistakes, and we just don't want to be part of those medical mistakes. You know, we're pretty cautious of that. One of the things you want to do is you want to protect yourself against biohazards, and then always set your temperature for tissue type before you put your tissue in there. One of the things that's really important, if your tissue, when you're done freezing it, or if you're taking it from a freezer, you need to set it in the cryostat and let it come to the cryostat's temperature. Because when you're freezing it and embedding it, it's a lot colder than what's in your cryostat. So you don't want it to crack the block or anything like that. You need it to sit there for just a few seconds. It says 30 minutes up there, but we don't have that grace. You know, we usually cut it before. We give it a couple minutes to get to the cryostat temperature. Most cryostats, no matter how well they're built, have cold and warm areas. So you need to know what areas are the warmest so that you don't set any of your tissues in there and you know, cause them to thaw out just a small bit. So you need to figure out what your cold and warm areas are. You can use disposable things, so brush or anti-roll. Let's move it on a little bit quicker. This is an extreme. This is using it metal mold. What you want to do is you want to put your little, after you've embedded your tissue, you want to put a little OCT on your chuck. Now, like I said, this is extreme. I wouldn't make it this big. Wait till it gets hard and then put a little bit more of wet OCT on it. Then flip your block over. Now, please do not ever make your block that big, but it's just here to show you that if you, when you flip it over, the metal mold, you put your thumb on top, on the back of that mold, and it'll fall right out and stay stuck to your chuck. And like I said, this is an exaggeration, but the metal molds work just as well, and they're nicely shaped. And then you put it on your cryostat. The thing is about the cryostat, if you have an arm that comes out here, like most do, make sure that arm is completely back to the microtome, because the stability is lessened as it comes out towards the knife. So you really want to keep it as close, that arm as close to the back of the microtome. But the nice thing about that little mold is that you have a nice little square, and I would cut at the corner. Now here you can mount tissue that is really sturdy. You can do brain, liver, you know, if you have a good chunk of it, all you do is you put some OCT on the chuck, set your tissue on there. Don't put any OCT around it, just kind of make sure that it's around the bottom only. And you can cut it without embedding it, as long as that tissue is frozen. And this one was frozen on the dry ice, so it did the slow freeze. And when you go to cut it, I used the anti-roll plate, and there's your tissue piece. And it stayed really nice, and it doesn't move. Notice I'm using a regular knife on this, a stainless steel knife. And then you pick it up, and it's right there. So that works really nice, but you can't use the brush. If you want to use a brush, you have to embed it completely. But that works nice if you have to do multiple sections through that. A lot of times we have pieces of liver that are large that we have to hit certain spots, make sure we have certain central veins in there and stuff. And so we just don't embed it completely, we just cut through it. We attach it and cut through it. Okay, one of the things when you embed, you want to trim the block down. If it's like a mishmash of everything and it has no shape, you want to trim it so that you have a point with open embedding medium so you can grab it, because we're going to use a brush to cut this. instead of using the anti-roll plate. That way you have a piece to grab and kind of guide it down off on your knife without touching the tissue. And that's really important because the brush will put little holes in your tissue and it put scratches in your tissue, even camel hair. Here's another example in a different cryostat using the brush where it's embedded completely. You grab an edge, and there's the section itself, nice and flat. There we go, and then you can pick it up very easily. One of the techniques about picking it up is that you need to have this arm down behind your knife so you have room to move your slide around. It's really important because otherwise if your tissue was up here, you don't have that space to pick up your section, or at least place it on the part of the slide that you'd like to have it in. This is one way I'll go through very quickly. It is if you have a small, tiny, tiny piece that you absolutely have to cut that, and you don't want to put it in liquid nitrogen because it's just too small and too fragile. This is one of the ways that you can do embedding real quick and get it right where you want it using your freezer bar. What you do is you take a slide, you set it on your freezer bar, a clean slide, set it on your freezer bar, and you put a little OCT on it. I don't know if you can see it. You just put a smear of OCT on there or embedding medium, and you set that tissue where you had it marked, face the marked side down into that OCT and let it freeze on that slide. There you're placing the tissue. You then put a little bit more OCT on that and take a second slide and stick it on top. And that's going to keep it nice and thin so that you don't have a lot of embedding medium to mess with. So then you get a chuck and you get a little OCT on while it's still liquid. Take your finger and slide that slide off, and then off of the tissue, off the top slide, and then take the bottom slide and put it onto that OCT. And there's your tissue. Now it's not very pretty, but there it is. Once it's frozen, put your thumb over here and slide that slide off, and you'll have the tissue. And you don't have a big gob of embedding medium. Trim it down, and you have the spot exactly where you wanted to cut, right there, and it's nice and flat. But you have to use your freezing bar. A lot of things that I cut that don't stay together well, I use a Cryotomy tape transfer method. It's a very simple method. I don't know who owns that now, but it is a product that's just tape. And it has a method where you roll it out on the tissue itself and then roll it out on the slide. Make sure the tapes adhere to the slide and the tissue. And it's all in your handout or your notes. And then there's a UV light that cures the tape so that you can lift the tape off and the tissue stays on the slide. Now this is a great method, but you can also use Scotch tape for it. Some of the tissues, if you have to do it real cold, the Scotch tape doesn't stay too well. But if you use a tiny roller like a wallpaper roller and put it on there, it will stay on long enough to get your tissue off and put it on the slide. And all you do is just let it dry, and it will on a warming plate, and it will go ahead and lift off for you to stain. Now, a lot of tissues, frozen sections, you fix after you cut them. I always recommend a little bit, not as long as this says. If you have the time, go ahead and do this air dry that long. But usually what we do is we have a low temp slide warmer. It's about 37 degrees, maybe a little bit less. And we let it sit on there for air drying because we don't have time to mess with letting it air dry for anything. Now, when we do immunohistochemistry, we can leave it dry. We cut them all one day, and then we let them sit air dry overnight, covered. And that way they stay on really, really well. We use different fixatives. So acetone and alcohol mix is my favorite, and I like it when it's at room temperature. There is a nice cold acetone mix, 50-50, that you can use with alcohol. That works well, and it doesn't destroy the morphology. There are some, though, immunohistochemistry stains that you can't, some of the CD markers that you can't use acetone with. It will wreck the morphology of it, and it will not stain properly. For some reason, it masks the antigens in the tissue. Do not use methanol to fix any tissue whatsoever, because it really does play with the morphology. If you don't want to fix it at all, make sure you dry it before you go to stain it, because it will fall off the slide. And I use those double, triple stick coated slides, and they still will fall off if you don't let it air dry or even low heat dry. So, and to store them, I would suggest that you store them, if you're going to do long-term storage, like if you're going to use them for controls, use a -80 freezer. If you're only going to keep them for a short time, I would use a -20. That's not self-defrosting. That's very important, because if it does self-defrost, they thaw out a little bit, and then they start losing their morphology because the water's there. Never store your slides in a cryostat. You can store them after they're fixed, or you can do them unfixed. If you air dry them, you should fix them the same day. And if you're going to store them for any long time, I would let them air dry and then fix them. I wouldn't let them air dry for 4 hours, only overnight, but fix them, and then store in a box, put them in a slide box, and put some of that silica gel in there with, put like a little tea bag embedding, and then put that silica gel in there and staple it, as you can see here, and put them in a box, because when the water in the freezer, if they get moisture in the freezer, that's what destroys your frozen sections. And then when you go to take them out and use them, open it up, take it out, the ones you're going to use, and close it back up real quick and put it back. Do not thaw and refreeze the slides. The morphology is horrible on them. And if you're going to have to store the block, seal the block. Put some OCT or embedding medium across the face of it. Wrap it up in foil, store it in a Ziploc bag, or there's 50 ml conical tubes, or freezer boxes. Don't ever touch the block with your bare hands, because if you're going down the road and you're going to do some in situ, you might leave some tissue skin on there, skin tissue on there that would interfere with the staining. And cut the block only once if possible. If you're going to have multiple slides, go ahead and do them at one time, because taking the block out of the freezer and recutting it is not good for the tissue. So, and if you have a big piece of tissue, cut it up into small pieces if you can, and freeze several small pieces and store some, but cut a couple. And then if you don't have the right diagnosis, or if it's not looking right and they want to see more, you can always go back to the freezer and get the rest that's left over. Because big pieces of tissues are not good to cut. You really don't have good morphology. And there is, especially if you're using liquid nitrogen, the bigger they are, the worse it is for when you use liquid nitrogen that's not controlled. Okay, don't use a self-defrost freezer, no cryostat storage, and -80 for long term, and I always say -20 for short term, but we have a couple we have one that's set at -27, which I don't, for months or weeks.
Thank you, Diane. We appreciate that. That was a very informative webinar. We do have some questions. If anybody else has any questions, please type those into the question box. And while they're doing that, I just want to do this month's feature product. We will be introducing a new cryostat by mid-summer, and it is the TissueTech Cryo 3 Plus. It has new touch screen controls, an option of 2 ozone disinfection cycles, a long and a short. And as Diane mentioned, that there are cryostats on the market that have temperature controls different areas, and our blade holder is now temperature control to aid in sectioning. So be on the lookout for this cryostat. It will be on the market mid-summer. And our next presentation, our next webinar, is scheduled for June 14th, and this topic is standardization in the growth room, and Lamar Jones with Emory will be our presenter. If you haven't already registered, please register on our website. The first question is, have you used 3M Novak 7100 fluid to rapid freeze tissues?
No, I haven't, but I heard about it, and I was wondering how that worked. You know, I looked into it a little bit, and then I got sidetracked somehow, but I heard about it. I have not tried it.
Thank you. The next question is, what is the best OTC you have found for skins, especially skins with quite a bit of fat attached? I have tried a couple of types. One had toluene and did great. The other is very safe and isn't doing so well.
Yeah, there is a harder one that I use. It's almost like ice. Actually, when you cut it, it sounds like ice. And it was made by, I wish I would have brought my list. It was a free sample, and I just loved it. I think it was IMEB sells it. Okay. So that would be Triangle Biomedical.
Okay. Thank you. The next question is, in what instance do you think it is better to save extra tissue frozen rather than processed normally for diagnosis?
Sometimes I find that when you save, like, especially like I said, before Mohs came about, the technique came about, we did a lot of skin, Mohs-like techniques. And we found that we kept it frozen because maybe a day or two later, they would want to see it frozen again, you know, in the same state. So that's when we would cut back, or if we had a large piece of tissue of a spleen or something, we would kind of hang on to it. I know that you don't need the spleen, but if there was something suspicious in it, we would make sure that the doctors would have the same method done for it, the same way they made the first diagnosis.
Well, thank you. That completes all of the questions for today. Thank you once again for taking the time to do this presentation. I'm sure everybody enjoyed it and really got something out of it.
Also, too, they're welcome to email me, and I can probably give them better names and stuff. But yeah, cryosectioning is not fun, and you know, you have to make it as easy as possible. So the best way is discover your best way and work with it.
I do have one more question that popped up that I would like to ask if you have the time.
Mm-hmm.
I have frozen sections that were stored in a negative 80-degree freezer that IHC was performed on, and the sections fell off. This person used stiff-coated slides with new saline. Any suggestions to prevent the tissues from falling off?
The best thing is to make sure they stay, there's no moisture that gets into them. That's the thing that takes, it really not only wrecks the morphology, but it will lift the tissues off the slide. So put some silica gel in there or whatever you can, dried right, whatever. Just get it in there to keep it dried and seal them up.
Thank you.
You're welcome.
Thanks again, everybody. I hope everybody has a great afternoon.